It begins often with a whisper, a subtle change in bowel habits perhaps, a flicker of blood in the toilet bowl, discomfort, easily dismissed. These are the insidious whispers of colorectal cancer, a disease that often progresses silently before revealing its presence. This year, countless individuals will receive a colorectal cancer diagnosis, facing a battle they never anticipated. The statistics are stark, the impact immeasurable. But amidst the concern, there is hope. Hope fueled by knowledge, awareness, and advancements in detection and treatment. This essay delves into the complexities of colorectal cancer, empowering individuals with the understanding needed to protect their health. Colorectal cancer, also known as colon cancer or rectal cancer, originates in the colon or rectum, parts of the large intestine. The colon, a muscular tube, plays a crucial role in digestion, absorbing water and nutrients from food. The rectum, the final portion of the large intestine, stores and expels waste from the body. This intricate system, essential for our well-being, can be compromised by the development of cancerous cells. These cells, arising from genetic mutations, multiply uncontrollably, forming a mass known as a tumor. While the exact causes of these mutations are complex and multifaceted, a combination of genetic and lifestyle factors is believed to play a role. Family history of colorectal cancer significantly increases an individual's risk, highlighting the influence of inherited genetic mutations. Inherited syndromes such as Lynch syndrome and familial adenomatous polyposis, FAP, further elevate the likelihood of developing this disease. While genetics lays the groundwork, lifestyle factors wield considerable influence. Diets high in red and processed meats, coupled with low fruit and vegetable intake, have been linked to an increased risk. Physical inactivity, obesity, smoking, and excessive alcohol consumption also contribute to the development of colorectal cancer. Understanding these risk factors is paramount in prevention and early detection. By making informed choices about our health, we can mitigate risks and empower ourselves with the knowledge to recognize potential warning signs. Colorectal cancer, often dubbed a silent killer, can manifest with subtle symptoms, easily mistaken for other conditions. Recognizing these whispers of distress is crucial for early diagnosis and intervention. Changes in bowel habits, including persistent diarrhea, constipation, or a change in stool consistency, warrant attention. Blood in the stool, whether bright red or dark and tarry, should never be ignored. Abdominal pain, cramping, or bloating that persists despite dietary changes may also signal an underlying problem. Unexplained weight loss, fatigue, and weakness can accompany colorectal cancer, often attributed to other factors. Iron deficiency anemia, resulting from microscopic bleeding in the tumor, can manifest as fatigue, shortness of breath, and pale skin. It's important to remember that these symptoms are not exclusive to colorectal cancer and can indicate other conditions. However, experiencing any of these symptoms necessitates prompt medical consultation. Early detection is paramount in the fight against colorectal cancer, as timely intervention significantly improves outcomes. Diagnosing colorectal cancer begins with a thorough medical history and physical exam. Your doctor will inquire about your symptoms, family history, and lifestyle habits. A digital rectal exam, where the doctor inserts a gloved finger into the rectum to check for abnormalities, is often the first step. To visualize the colon's lining, a colonoscopy is considered the gold standard for diagnosis. This procedure involves inserting a thin, flexible tube with a camera attached into the rectum and threading it through the colon. Colonoscopy allows the doctor to detect and remove polyps, small growths that can develop into cancer over time. Other diagnostic tests, such as a sigmoidoscopy, which examines the lower part of the colon, or a CT colonography, a virtual colonoscopy using CT scans, may be recommended. Biopsies, small tissue samples taken during colonoscopy or other procedures, are examined under a microscope to confirm the presence of cancer cells. Blood tests, while not diagnostic on their own, can provide valuable information about liver function and tumor markers, substances released by cancer cells. Early detection is crucial, as it significantly increases the chances of successful treatment and improves long-term outcomes. Regular screening, even in the absence of symptoms, is essential for individuals over the age of 50 or those with an increased risk. The treatment landscape for colorectal cancer has evolved significantly, offering individuals hope and a chance at recovery. Treatment plans are tailored to each patient's unique needs, considering the stage of cancer, location, and overall health. Surgery, often the primary treatment for early-stage colorectal cancer, involves removing the tumor and surrounding lymph nodes. The type of surgery depends on the tumor's location and size, ranging from minimally invasive laparoscopic procedures to more extensive open surgeries. Chemotherapy, using drugs to kill cancer cells, may be recommended after surgery to destroy any remaining cancer cells, reducing the risk of recurrence. Radiation therapy, which uses high-energy rays to target and destroy cancer cells, can be used before or after surgery, or in combination with chemotherapy. The choice of treatment modality, or a combination thereof, is guided by a multidisciplinary team of specialists, including oncologists, surgeons, and radiation oncologists. Advances in surgical techniques, chemotherapy drugs, and radiation delivery have significantly improved treatment outcomes, increasing survival rates and enhancing patients' quality of life. The fight against colorectal cancer continues to advance, fueled by groundbreaking research and innovative treatment approaches. Targeted therapy, a newer class of cancer treatment, focuses on specific molecules involved in cancer cell growth and survival. Unlike traditional chemotherapy, which targets all rapidly dividing cells, targeted therapies aim to disrupt specific pathways crucial for cancer cell proliferation. Immunotherapy, another promising avenue of research, harnesses the body's own immune system to fight cancer. Immune checkpoint inhibitors, a type of immunotherapy, release the brakes on the immune system, allowing it to recognize and attack cancer cells more effectively. Clinical trials, research studies involving human volunteers, play a vital role in evaluating the safety and effectiveness of new treatments. These trials provide individuals with access to cutting-edge therapies and contribute to the development of future breakthroughs. Genomic testing, which analyzes the genetic makeup of tumor cells, is paving the way for personalized medicine in colorectal cancer treatment. By identifying specific genetic mutations driving cancer growth, doctors can tailor treatment plans to target those vulnerabilities effectively. The future of colorectal cancer treatment holds immense promise, driven by a relentless pursuit of scientific discovery and a commitment to improving patient outcomes. In the realm of colorectal cancer, early detection emerges as the most potent weapon in our arsenal. When discovered at an early stage, before it has spread beyond the colon or rectum, colorectal cancer boasts a high survival rate. Regular screening plays a pivotal role in this early detection strategy. Screening tests, such as colonoscopy, can detect precancerous polyps, small growths in the colon or rectum that can develop into cancer over time. Removing these polyps during colonoscopy effectively prevents cancer from developing, making it a powerful preventive measure. For individuals at average risk, screening typically begins at age 50. However, those with a family history of colorectal cancer, inflammatory bowel disease, or other risk factors may need to start screening earlier and undergo more frequent testing. The decision about which screening test is right for you is best made in consultation with your doctor, considering your individual risk factors and preferences. Remember, early detection is not merely about finding cancer early, it's about preventing it altogether. A cancer diagnosis can be overwhelming, casting a shadow of uncertainty and fear. However, it's essential to remember that you are not alone on this journey. A network of support and a wealth of resources are available to guide you through every step of the way. Your healthcare team, including doctors, nurses, and social workers, provides medical expertise, emotional support, and practical guidance. Support groups, both in person and online, offer a safe space to connect with others who understand the challenges you face, sharing experiences, coping strategies, and a sense of community. Organizations dedicated to cancer support, such as the American Cancer Society and the National Cancer Institute, provide valuable information, resources, and financial assistance programs. Navigating the emotional and practical aspects of a cancer diagnosis requires strength, resilience, and a strong support system. Remember to prioritize your well-being, practice self-care, and seek support from loved ones and professionals. You are not defined by your diagnosis. Your strength and resilience shine through as you navigate this chapter of your life. While we can't control our genetic predisposition to colorectal cancer, we can make lifestyle choices that significantly reduce our risk. A diet rich in fruits, vegetables, and whole grains provides essential nutrients and fiber, promoting digestive health and reducing the risk of colorectal cancer. Limiting red and processed meats, high in saturated fat and associated with an increased risk, is crucial for cancer prevention. Engaging in regular physical activity, at least 30 minutes of moderate intensity exercise most days of the week, plays a protective role against colorectal cancer and numerous other chronic diseases. Maintaining a healthy weight through a balanced diet and exercise is essential for overall health and cancer prevention. Quitting smoking, a significant risk factor for various cancers including colorectal cancer, is one of the most impactful steps you can take for your health. Limiting alcohol consumption, as excessive alcohol intake is linked to an increased risk of colorectal cancer, is another important preventive measure. In the face of colorectal cancer, knowledge is power and advocacy is our voice. By staying informed about the latest advancements in screening, diagnosis, and treatment, we empower ourselves to make informed decisions about our health. Don't hesitate to ask your doctor questions, seek second opinions, and advocate for your needs. Regular screening is paramount, and early detection saves lives. Share your knowledge with family and friends, encouraging them to prioritize their colorectal health. Support organizations dedicated to cancer research and advocacy, contributing to the advancement of scientific discovery and patient support. Together, we can raise awareness, break down stigmas, and create a future where colorectal cancer is no longer a silent threat. The landscape of colorectal cancer is constantly evolving, shaped by groundbreaking research, innovative treatments, and unwavering hope. While the statistics may seem daunting, it's essential to remember that progress is being made every day. Survival rates are improving, treatments are becoming more targeted and effective, and our understanding of this complex disease continues to deepen. The future holds immense promise, fueled by the dedication of researchers, healthcare professionals, and individuals committed to raising awareness and advocating for better outcomes. By embracing the power of knowledge, prioritizing our health, and supporting one another, we can create a future free from the fear of colorectal cancer. Together we can rewrite the narrative, transforming this challenging diagnosis into a story of hope, resilience, and triumph over adversity.